tonight's live is going to be about male pattern baldness, really hair loss in men, and some of the treatments that work. I'll be discussing quite a few things. I've got my notes here, trusted notes, and I will be also discussing matters to do with acne, because we are in the month of acne awareness month, and so I want to talk about things to do with acne. I kind of want to introduce the acne subject and see where I go with that. Pardon me, and see where I go with that within the week or the rest of the month. I want to touch base on those things. If you can hear me, let me know that you can hear me and that I am sound and clear. But I need to do housekeeping as usual. My name is Desiree Djanie. I am an advanced hair, scalp and skin practitioner here in Leicester. Within my clinic, I help solve people's hair, scalp and skin concerns, and I also help with clients and patients who perhaps want to prevent getting hair loss or hair shaft disorders, but want to live their life a little bit. They want to enjoy some things in the hair space, within the hair space, without the risk of losing their hair. And so that's where I come in. I introduce them to my methods. I use vegan and organic products, and I do these treatments on a sympathetic level that helps to ensure that their hair, scalp and skin is held intact and isn't aggravated by these treatments that we do in the salon. So I also, before I forget, help professionals within this industry to perfect their treatments and service offerings that they provide. And I do so by going out to the salons that they work at or their establishments, and I help them to really hone in on their skills. And sometimes they come in to see me and I also train them. And I run courses for people who can't reach me, who can't come to me, but want to enjoy taking care of their hair themselves. And I always say that it's important to know that care over your hair should be a tool. It should be something that you have, a skill that you have, that you can heavily rely on, and then you use a professional for the remainder of the other treatments that you need, for example. So for example, skincare, we have a parameter, we have treatments that we can perform that an average person shouldn't get their hands on those tools and machines and techniques that we use. We have to present certain qualifications and certifications before we're allowed to buy those machines. And so this is when we delve into the advanced skincare, because the things that you can do at home topically and some of the machines that you can use at home may work, but they have low level strength. So the strength levels are reduced so that you don't cause yourself any harm. And so a professional or an advanced therapist or practitioner is best suited for those highly technical treatments that really move the needle in your skin, scalp and hair care. Okay, so I want to discuss acne. I think I'll start. No, I will start with androgenetic alopecia, so male hair loss, so hair loss in men, and how we sort of deal with that subject. It is a subject that is something that I'm conscious of, that it's a big deal. It's really quite important to men, but it isn't discussed very often. People tend to shy away from it. I have heard women say, well, does hair loss actually matter in men? I mean, don't they just shave it off and just move on? But truly, that's not the case. I have got clients who start to ask me about hair loss treatments for their better halves, and they want to find out where they can, or what treatments that will be useful for them in their hair loss journey. And so it's not something that men put away. It is, or something that men aren't concerned with. It plagues men just as much as it plagues women. And so since I've recently had some men enjoying my lives, I thought I would dedicate today's live to men and hair loss that concerns men. Okay, so the issue that we find with men hair loss or male hair loss is that men tend to go out and look for these miracle cures. In fact, we're all guilty of it. Women do the same. But, we tend to go out there and we look for these miracle cures. I mean, we're calling these miracle cures because they don't really have an effective way of reversing androgenetic alopecia. We haven't found that it makes any cosmetic significance at all. And so we struggle to really use that within the treatments that we offer. So all the treatments that we offer in this space, we use products that are marketed for the conditions that we're treating. So there are 5 tests that products must meet, and these tests are that products must have had clinical trials. It must have had appropriate clinical trials. So not just any clinical trial, but appropriate clinical trial to do with the product that is being marketed. It needs to, the clinical trial needs to have been performed with the best statistical protocols. So they must have used the right sort of statistics to come to the conclusion that they came to. It has to have been conducted by experienced researchers, for example, people who are within the space of the area that is being that the product is being formulated at. Okay, so 4 tests. I'll correct myself. 4 tests that it must meet is that the product must have been clinically trialed. Okay, so appropriately clinically trialed. It must have been done with the best statistical protocols to make sure that it has got the numbers, in the fact that the research has been collected with good numbers that actually reflect the research that's been done. It needs to have been done by experienced researchers who are within the space, and also must be of good repute. So they must be of good reputation to have conducted such clinical trials. So when you're buying products for your hair, whether you're a man, woman, or any other way of recognizing your gender, you must ensure that the product meets these 4 tests. So these 4 tests are met by the product. Okay, so I've already highlighted them. And so if a product doesn't meet these tests, how would we know? How would we know whether it meets the test or it doesn't? You can go on the website and check within the brand's website to find out what sort of clinical trials they did. You can, do your own research. You can give them a call and find out what they did to come to the conclusion that these products aren't just miracle cures. Okay, so we also call these miracle cures because without prior diagnosis and relevant treatment plan, we don't know how this is going to actually cure anything. If you don't know what you're curing, how do you know that the product that you're using would actually work for the disease that you're trying to treat? Okay, so we need to make sure that these products are going to work properly. So a proper diagnosis, not an erroneous one. So going to a professional to look at you and give you a proper diagnosis and give you a treatment plan and recommend products that would actually work is a good way to go. Okay, so if you notice when you buy these products, these miracle curing products, they tend to not make claims. They don't make claims that they're going to cure this disease. They rarely make those claims. They just air around and they skirt around, and they don't actually make a bold claim of what they're going to do. So, they kind of play around with words a little bit. So be careful of those. Okay, now I am not opposed to any use of herbal or natural products at all. If it works for you and you've used it before, or someone that has worked for, each to their own. If it works for you, please go ahead. Okay, I don't have any concerns whatsoever with things like that. The only issue we have is when you're using products that aren't formulated for the scalp and you're leaving it on the scalp for a prolonged period of time. So you can do scalp care, you can use herbal and natural products, but you must make sure that it doesn't stay on the scalp for too long. Because as I've mentioned in the past, we want to make sure we are protecting the sebaceous gland. This is a very important gland. Its anatomy, unfortunately, is not completely correct. So I have to make sure that I highlight the fact that there are some mistakes here. But the sebaceous glands, we must ensure that we are taking care of that. We must protect the sebaceous glands. They're not things to play with, really. So they are the glands that produce sebum. Okay, this is the waxy oil. We also call it oil gland. So you'll hear people call it the sebaceous gland or the oil gland. So this is an anatomy of your skin. So the top layers are the top layer of your skin, and then this is the further depth, the deeper levels of your skin. And this is where your hair lives. This is where it starts to grow. That's the matrix where it's being fed blood, and then it grows hair into the follicle. So this is the hair follicle, and the hair grows inside of this tubular area. We don't call it a tube because it doesn't look like a tube, but for the purpose of what we're discussing, so this is where the hair lives. And so we want to protect the sebaceous glands at all times. It's so important to do so because that is the area that has, there's a bulge that is around that same area, which also has stem cells in there. And we must make sure that we're protecting that against immune damage. Okay, so by putting products on your hair, you're not allowing your sebaceous glands to work properly. Remember, they deliver sebum to the hair, which is antimicrobial, antibacterial, really helps to balance the pH of the skin. So it's there to do its job. And so by not allowing it to do its job and putting things on that hair, on your skin, sorry, your scalp, by putting things on your scalp, you are blocking this area, okay? This hole that the hair's coming out of. You're blocking that, or you're stopping the sebum from actually traveling north, because that's what it does. It travels north, upwards, and really lubricating. So it has a lubrication factor, which lubricates the strands of the hair, but it also lubricates the surface of the scalp. It's antibacterial and antimicrobial also. So we make sure that we are getting that beautiful, naturally occurring agents that help to protect our scalp. So by not doing that, by not leaving the scalp to do what it needs to do for a prolonged period of time, what you're doing is you are stopping the sebaceous glands from doing their job. So we don't leave products on the scalp for too long, but apart from that, if you're using things and you feel that you are happy with that and it works for you, if it's working, go ahead. We don't object to that. We're just mindful of what the damage could be to your scalp. Okay, so we've discussed the matters to do with the scalp. We've discussed miracle cures. I want to also talk about the fact that not objecting to people using these products, the reason behind it is that, almost any product will help somebody to some degree at some time. Almost any product will help somebody at some degree at some time. And so if something has worked for somebody, a product of any kind has worked for somebody to a certain level, sometime in their lives, and they make a recommendation for you to use that, it is true, it did work. But will it work for you? Will you still get that cosmetic acceptance, or that cosmetic significance or significant result in the product that you're using? Would it be acceptable to you cosmetically? Would you see, or will you be able to see a development in your hair and scalp that you can say is acceptable? That's what you need to find. You need to be able to test that. So a product might work for somebody to some degree at some time in their lives. And so be mindful of that when you're using products for your hair. But we have never found that these products have made any sort of reversal of severe or well-established male hair loss. We haven't found that these products have actually helped significantly in any severe or well-established male hair loss conditions. So it doesn't mean it doesn't work. It just doesn't mean that we have not found that it has. Okay, so we need to make sure that we're using products that have been researched and licensed to work for the conditions that they are designed to work for. Okay, so we're looking for products that are going to treat conditions. So these are therapeutic products that have been designed to actually help these ailments that we might be going through within the hair, the scalp, and the skin. Okay, so we need to talk more about the research and things like that people go through to make sure that the products that they send out into the world actually does the work that it says. But all in all, just be mindful of clever marketing, clever marketing is going to be the bane of our lives as we try to solve hair loss conditions. Okay, so therapeutic drugs are great when they're designed to actually help. But I want to talk about some of the things that will influence the success or influence the hair. And this goes for both men and women. So I'll go through the list of things that people should be mindful of that can affect the hair in men and women. So conditions like anemia. So anemia is just the body's inability to produce enough healthy red blood cells. And so when somebody's not producing enough healthy red blood cells, they will start to experience the condition called anemia. So if you're going through that will affect your hair growth. Okay, so diabetes, for example, could be unhelpful to hair loss conditions. Thyroid disorders, for example, is another condition that just whether your body's not responding to insulin, for example, or your blood sugars are too high. And some of the conditions some of the symptoms that can happen because of thyroid issues are sort of tiredness, depression, anxiety, and also obviously can affect the hair also. We have vitamin deficiencies. So if you're experiencing a deficiency in vitamins, so you're not actually getting all the nutrients that you need, that can definitely affect your hair growth. Malnutrition is also one, in the sense that if you're not getting enough nutrients because maybe you're following a weight management diet, for example, or you have, without your intentions, lost a lot of weight very drastically, that could be a shock to the system, and so you can start to lose hair. We have pregnancy, which also really affects the hair in a positive way to begin with. And then once you've had the baby, you start to experience postpartum shedding. So this is towards the women. But in general, all the other things that I'm mentioning can affect men also. And then we talk about oral contraception and how it affects women in the way that it works. And that helps with sort of excessive hair growth with women, but I'll discuss that another time. Today, we are dedicating today to male hair loss. So autoimmune diseases can affect hair loss too, and genetic influences can affect hair loss in men. Stress is a big factor also for all of us, and so that needs to be addressed. So we need to make sure that we're not producing too much cortisol, so our cortisol levels aren't too high, and that we can maintain that healthy balance in the production of hormones within our bodies. Certain infections can also have an effect on hair growth, and if somebody goes through a change in their temperature, so we call that pyrexia. If there's a change in your temperature, a sudden increase in your body temperature, that can affect the hair as well. Okay, so I want to speak about the way the pattern of the hair is in terms of loss within the male hair loss area. Okay, so male hair loss can occur around the hairline, so where you've got that sharpness of the hairline, so it can just start receding. We can also get baldness at the top, at the crown, for example, and it can just grow and grow and grow around, or increase in size around the crown of the head. Okay, so we have treatments that we use for male hair loss. And we find that, finasteride works really well. So does minoxidil. So minoxidil is usually just applied topically. You can get it in 2% or 5%. It usually comes in a foam, and you put that on the area of the scalp, and that tends to work really well. And we sometimes prescribe that in conjunction with finasteride. So it can be used together. So you take finasteride orally, but then you put minoxidil on topically. Okay. So we need to speak about, what is happening to the body as, pattern baldness is occurring, for example. So we need to make sure that, there isn't any sort of associated losses in other areas. We need to observe certain areas around the face of men. We need to maybe address the eyebrows, the chest, the back, other areas that normally we get hairs that we call terminal hairs. So hairs that are on our scalp or in the pubic areas are what we call terminal hairs. These hairs have got a life cycle, and they tend to be very, very strong hairs that go through the entire life cycle. We have other hairs that don't stay on the skin, like lanugo hair, for example, which is hair that babies are born with, and then they shed that hair, off their skin, and they're very fine hairs, and they just shed the skin. They shed the hair straight away after birth or shortly after birth. And then we have vellus hairs, which are the hairs on the back of our hands, for example, on our faces. So when you go to have certain facials, you find that they will try to remove the fine downy hairs on your face. So those are what we call terminal hairs. They don't tend to have cortex. They don't tend to be strong enough. And so they are just hairs that are just fine, that when we remove, they don't grow back really any thicker or anything. They don't tend to get, become weighted in their the size of the actual hair strand does not increase in any way. No changes happen to it when we cut that hair. So if we cut terminal hairs, for example, we find that if you bulk them together and you cut it, it becomes strong. It appears stronger, and the weight of it is distributed differently. But with vellus hairs, that's not the case. It just really isn't the case at all. They're just completely different in the way that they are in texture and in just the coarseness of them. So they're the hairs on our faces, and in maybe at the back of our hands, maybe for women, but men, they can have terminal hairs in other areas, such as the face, the head, the chest, and the back. Okay. So we've spoken about miracle cures. We've spoken about how to make sure that your products that you're selecting are actually going to work for you. We've spoken about how marketing is geared to get you to buy products, and there are tests that they must satisfy. And if your products aren't satisfying those tests, then you should be mindful of, you should be skeptical of buying these products. Okay, and we spoke about whether herbal treatments and natural treatments are good for you, and I expressed that I generally don't, advise clients to stay away from these treatments, because treatments will work for somebody at some time, to some degree, somewhere. So if it works for you, then it works for you. If it doesn't, then you must stop. But these products that we buy that are miracle cures haven't had enough research and aren't licensed to be used clinically. Okay, so products that are licensed to be used clinically for male pattern baldness are minoxidil and finasteride in the UK, and they're great in the way that they work. But of course, please make sure that you get a proper diagnosis. I haven't done my I haven't said that, really this live is, or these lives that I do are for educational purposes, and they are not for you to go off and start treating yourself and taking my advice and doing things with it. I am not a doctor, I am not a GP, I am not your doctor either. And so if you are needing to use anything at all for your hair and scalp, it is good to get a proper diagnosis, and so that a treatment plan will be devised for you, and then you can really save time, effort, money, and disappointment. Okay, so if any product, basically what I'm saying is that if any product promises you spectacular results, I will be very skeptical in dealing with it if I were you. If any product at all is marketed anywhere that tells you that it's going to solve this issue for you, please err on the side of caution and be very careful, because it could be a waste of money. A proper diagnosis and a treatment plan is what you need. Okay, so I want to talk about acne. I'm just going to quickly move on to acne so that we don't spend too much time. But if anybody wants to know something more in detail about some of the things that I've discussed, please just make a comment on this video wherever you find it, on YouTube or Instagram or TikTok, wherever you find this video. You can ask any question and I will answer from there. But also need to talk about the side effects that you may have from some of these treatments, and how to use some of these treatments. So I'm just going back quickly to the male hair loss part before I move on to the acne. So finasteride is a product that is also called Propecia or Proscar, for example. So you'll find that it is something that you take orally, as I've explained, and apparently now you can find it in a topical form that you can apply. But they are prescription only drugs. You shouldn't, in the UK at least, you shouldn't be able to source that anywhere over the counter, for example. They are prescription only products. Okay, and so you apply that on the front of the head where the hair loss is, and it seems to work brilliantly, wonderfully. And so the same with sort of minoxidil, but you apply that also onto the area of the scalp, which is the top of the area. Some of the side effects that we have had reported are things like loss of libido, or some other undesirable effects in men. So be mindful of that when you're taking that. But what also is, what we know is that these are, they disappear. These side effects do disappear after a short period of time. So it's just at the introduction rate of the products and the treatment that initially gives these symptoms or these side effects, but after a period of time that those subside. Okay, so we usually expect people to start to notice an effect in the treatments that they're having within 3 to 6 months. So that's when you should roughly expect to start noticing some improvement. But 12 months is really the sweet spot when you notice that this is doing great and it's working for you. And this is the reason why we suggest that you partner up with a professional who knows what they're doing, because they'll be able to monitor that for you. They will be able to monitor your development and make sure that you are getting the cosmetically acceptable results that you need, okay, or that you're wanting. And so I have spoken about that. I need to also speak about the fact that if you abruptly cease using these products and these treatments, you will sometimes, well, most times more than not, experience undesirable effects, which will be hair loss. So there'll be shedding occurring. Now, this would have been the shed that you would have incurred anyway, but you will notice that, and usually that isn't something that is desirable at all. Okay, so moving on swiftly to to acne. I've still got my notes. I'm so sorry. I'm very grateful that people aren't complaining yet. I think not many people have been watching my live, so they're not really saying anything. But so acne. So acne occurs when the hair follicle becomes blocked. So when I discussed hair, scalp, and skin, there's a reason behind it, because they're all linked. Okay. They're all linked because this is a section of the skin. The anatomy of the skin is a model of the skin, and it has hairs growing from the skin, right? And so acne is when this hair follicle, or rather, this is the follicle, this is as far as it goes. So when it gets blocked, it could get blocked further down here, or it could just get blocked up here. So what's basically happening is that excess sebum, excess sebum that is released from here is mixing with the dead skin cells at the top right there, and that mix can actually block the hair follicle. Okay, so the mixture of the two becomes a substance that blocks that hair follicle. Okay, and this can happen in the face, the chest, and the back. So acne can occur wherever there is blockage caused by sebum and dead skin cells. Pardon me. And so when there are hormonal changes, we also find that people start to experience acne. So this could be during the teenage years, where testosterone levels are high, and we also notice that even in girls, when they are of the puberty age, their testosterone levels are high, because they use that to build muscle and strength within their body. So that can also increase the chances of getting acne. And genetics also have a factor to play in this. And we find that if somebody in the family had acne, there is a high chance that a teenage child will also experience acne. And some of the things that we notice is that people start to assume that acne occurs because the skin isn't clean, and they think it's just down to somebody not just having their personal hygiene really looked at. We find that acne does not occur because of unhygienic areas, or areas of the skin, because really it doesn't necessarily happen at the top of the skin. As we know, it's really occurring because sebum production is mixing with the dead skin cells and is blocking And so it's not really to do with cleanliness. And so when patients tend to over clean their skin because they think they're getting acne, it becomes an issue because it just aggravates the condition. Another thing it does is that it dries out the skin because you're over cleansing, and you're going to end up causing more dryness. Also, it can make the skin oilier because by virtue of the fact that you're over cleaning, you're stimulating more oil production, and then the condition starts to get worse. It gets aggravating in other ways. So treatment can happen in terms of topical over-the-counter treatments that you can buy from the pharmacy, or you can be prescribed really strong medications by the GP, by your doctor, or antibiotics, for example, could be something that could be considered for you. Okay, so another thing I advise is that you don't squeeze your acne. It's so important that you don't squeeze your acne. People think that by squeezing the acne, it's going to go away. It won't go away by squeezing it. In fact, what you do is you're creating opportunities for scarring, pigmentation, and open pores. Okay, so when that sebum blocks the pores, which is the opening of the hair follicle, that's the hair follicle, comes all the way up. The opening is right here. So when the hair follicle is open and you are blocking it by squeezing, you're squeezing that mixture of the dead skin cell and the sebum, and basically imploding it inside of the hair follicle. So you really shouldn't be doing that. Okay, when you do that, you end up with blackheads, for example, or you end up with scarring of the skin. So try not to pop those acne spots. I'm going to talk about how to effectively look after acne, or after your skin when you're experiencing acne. Some of the things that you can use. So apart from the fact that you can go to your GP and they can give you strong acne treatments, sometimes we find that people really react from those treatments where their skin just becomes dry and it doesn't really do well, or they don't protect the skin from the sun. So they don't protect the skin from the sun when they're using these strong treatments, and then they end up with hyperpigmentation, which we then have to treat afterwards. So really getting bespoke skincare that is tailored for you to help you manage skin acne is so important. So this is the treatment plan that I normally take my patients through. So we would be using things that have these beautiful ingredients in there. I'm just going to discuss the ingredients and tell you their properties so that when you're out there, you're looking out for them. Okay, so we need to accelerate wound healing within the skin. This is for oily and acne prone skin. So when the skin is oily, it tends to sometimes become acne prone, or acne prone skin tends to become oily. And so we look for things like antibacterial ingredients that helps to also reduce the inflammatory response to the skin. And tea tree is very good for that. It really helps to it has the antibacterial effect. It also helps to give the skin a really nice anti-inflammatory skin wound healing response to the skin. We also use products that may have salicylic acid in there. Now, if somebody's allergic to aspirin, we don't use that, but salicylic acid basically is aspirin. That's the ingredient in there, and we use that a product that is rich in that to help to deeply clean the skin, but also mildly exfoliate the surface of the skin, just so that we can create that decongestion. So when that follicle is blocked because of the sebum and the dead skin cells, it congests the hair follicle. So although the hairs on our skin are called vellus hairs, and they really have, the purpose of them isn't as great as the hairs on our hair, which is terminal hairs, those hairs also have hair follicles. They're coming from somewhere. Okay, and so by blocking those pores, we end up with acne. So we need a decongestant. We need something that's going to decongest that skin area, the pores of the skin, and alleviate that congestion from there. So salicylic acid really helps us in doing that. But of course, if that's not going to work, you would use something else. So we would recommend something else. And building these things in does not mean that we don't actually engage in humectants and protecting the skin, and also preventing the skin from becoming dehydrated, because what you don't want is to treat the skin so aggressively and then it starts to become dehydrated because you think you've got acne, and so you go in with aggressive treatments, and then you leave the skin dry, and then that becomes a problem in itself also. So we use things that are humectants, that are great at capturing water from the atmosphere and hydrate the skin, and basically leave the skin protected from dryness. So glycerin is very good for that. Hyaluronic acid is also brilliant for that by the fact that they lock in moisture in that skin. Okay, so they attract moisture and then they lock it in, and that's what we love about these humectants. And then we need to look at things that will help to reduce the signs of the oiliness, really, because we don't want the oiliness to still remain even after we're treating the skin. So we would look at things to help to reduce those oiliness. Okay. So some things that we use are things like AHAs and BHAs. So alpha hydroxy acids are toners that we use for the skin, and we normally use that if someone is allergic to salicylic acid. So if someone's allergic to aspirin, we would use an alpha hydroxy acid to help them to really tone that skin, exfoliate it, and deep clean the skin. So we do have alternatives, and these are not singular active ingredients that we just pick up and just use. They are formulated within the products, and so they help to look after your skin. So they are combined and formulated properly. Okay, so apart from that, for now, I want to just leave acne here. No pun intended. But, we want to talk about this at great length, so I want to take it step by step. And I will move on at some point during the week to talk about acne rosacea and other types of acne, to make sure that we are really becoming well versed on acne and how to treat it. So just to give a recap of how acne occurs in the skin, and the fact that cleanliness or lack of cleanliness is not the reason why acne occurs. And so over cleansing the skin can actually aggravate the condition in itself. So we must be very careful when we're doing that. We want to make sure that we're not squeezing our acne so that we don't end up with hyperpigmentation and also scarring, because we don't want to have to treat all these things after we've treated our acne. Okay, we want to make sure that we're using products that are going to help to mildly look after the skin, so treat the skin of the treatment of the ailment that it's experiencing. So we don't do aggressive things. We are using things that are not only going to really give that antibacterial effect and anti-inflammatory effect, but also we need to go in and moisturize that skin. We need to attract moisture and we need to lock it into the skin so the skin can have the resilience that it needs to move on. So we're cleansing, we're deep cleansing, we're decongesting, but we're also making sure that we're attracting moisture and locking in moisture. So treating acne is not just to be harsh and astringent and exfoliating and all of that. You do need to have a really tailored attack on the condition so that you can get rid of it properly and learn how to manage it. And the skin that you're left behind with should be smooth, resilient, glowy, and moisture balanced, basically. So let's make sure that we're tackling acne properly. So we're making a real intention of dealing with acne. So I'm going to end by saying that if you are in need of any of these treatments that I offer, you can find me on Instagram at Vegan Hair Salon UK. And on TikTok, I'm also there, and on Facebook. And so you can access all my treatments on there. And if you want to know more about the things that I discuss, you can reach out to me at those social media platforms as well. So today we've spoken about male hair loss, some treatments. We've also spoken about acne in keeping with the Acne Awareness Month. And we'll continue talking about this during the next days to come. I'll delve a little bit deeper into other acne conditions and continue talking about the hair, scalp, and skin. So thank you for joining me. And if there are no questions, I will say good night and goodbye.